Hello and welcome to another episode of Every Possible Angle. I'm very excited for today's episode. We're here joined by Dr. Alin Gragossian, a physician leader of Equum Medical, medical consultant to Paragonix Technologies, and associate medical director of Donor Network West. Aline has been a counterpart to the company for a long time, and she also has a particularly interesting story, having been on really both sides of the stethoscope here as both a physician and a heart transplant recipient. Welcome to the podcast, Aline.
Thanks for having me. I'm really excited about this episode.
Excellent, excellent. I'm so glad you're here, and you have such a fascinating story. And I want to sort of start. You've always been interested in medicine, right? From a young age, you've always had an interest in medicine. Can you tell us a little bit about where that started?
I've always had an interest. When people ask me, because a lot of people assume that just because I have a heart transplant, that's what got me into medicine, but that's actually not the case. I even as a kid, and I never knew that I had any genetic issues as a kid. One time I do remember I was probably 4 or 5, and there had been like an accident. My parents' house is right by a park, and there had been an accident, and the kid got run over by a car on his bicycle. He ended up being okay, but an ambulance came to get him. And my parents said that I was so fascinated by like all of that, and not in a morbid way, but I think I remember, or they remember me saying things like, "Oh, what's going to happen to the kid? What's going to happen? Like, what are those people doing?" And so that's my origin story, but it's like one that I rarely remember. But my parents tell it very well. So I think I was always interested. There had never been anybody in my family who was in medicine. I'm a child of immigrants. They came here, with nothing in their 20s, and they had me and my brother. And so eventually, I started volunteering in an emergency department when I was in high school. And I think that's when I officially decided that I really wanted to go into medicine. And I ended up kind of, I did college, then I did grad school, I did medical school, and I actually kind of liked a little bit of everything, which made it perfect for me to go into emergency medicine followed by critical care medicine, because both of those fields are kind of a little bit of everything. You never get bored. And so that was kind of the reason why I chose it, was just an interest that I had since I was a kid. And then all the other stuff happened to me.
Absolutely. Well, that's wild. I mean, when I was in high school, I was not volunteering in the emergency room. That's incredibly impressive. And when you started in medicine, actually becoming once you got your medical degree and you were actually a physician in the emergency care units and then critical care, was there anything surprising to you, or anything that you didn't really expect for that was a major part of medicine, that from what your early exposures, both in as in high school and volunteering?
I think obviously a lot of the more like insurance, billing, like things like that, we are not taught, but for
Mm,
good reason, right? Like
right.
those things we learn as we go on in our medical career through, you know, after residency, after fellowship, when you have your private practice, or when you're working for a hospital. That's when you really learn all the stuff that you didn't necessarily learn in medical school. I would say otherwise, I think I mean, I feel like I end up being like, my boyfriend is also a doctor, but he's like it's just a job for me. I like really love it. Like I love every aspect of it. I was so excited about it until this day. Even when I have to do a shift, I get very excited to see patients. So it was nothing that I didn't expect, obviously, other than, some of the billing insurance things that come with time. As far as pathology and things that I would see, and patients that I would interact with, it was everything that at least I thought it would be. I also feel like, it ended up being, I mean, I knew it was going to be very, very difficult. I still think it's a very difficult job. But I feel like it ended up being harder than I thought it was going to be. You got to remember that people who go to medical school, usually we're all, straight A students at the top of our classes. We all go to amazing colleges, and we get there, and suddenly we're competing with other people who are exactly like us. So it was very, medicine in general is very difficult, but I feel like I wasn't anticipating how difficult it would be,
Yeah.
but in a good way, because I do like being challenged.
Well, that's excellent. And I'm curious, in terms of the start of your exposure to transplant, was it first in the emergency department or in critical care, and sort of on the donor side or recipient side?
When I start. So definitely in the emergency department as a resident. So I guess just for people to understand better, so I did my residency in emergency medicine, followed by a fellowship in critical care medicine, which is generally not the case. Usually you do an internal medicine residency and then go into critical care, but it's kind of a newer field to be able to do both of those fields together. I would say in the emergency room, I definitely was exposed to transplant recipients. For example, a heart transplant recipient or a kidney transplant recipient who might be having rejection or shortness of breath and they come
Right,
to the
right.
emergency room. Very rarely though, because in general transplant recipients are, very close with their team. They
Mhm.
usually get directly admitted. It's not always that you see them in the emergency room. So I remember, like, I had definitely been exposed. Obviously we learned about transplant in medical school, maybe like one lecture out of the millions, the thousands that we see over the course of 4 years. But in the ER, I would say, but as a fellow, as a critical care fellow, I definitely, I mean, I worked in the transplant ICU often. So liver transplant, cardiac transplant, lung transplant, kidney transplant was something that I basically helped with mm, almost daily for 2 years. So it was a great experience. I definitely was exposed to more when I went on to fellowship.
And so I'm curious, were you involved on the pre-care side or mostly in the critical care once they came out of out of the OR?
Both. If you're talking, so let me break it up to, have I ever taken care of an organ donor as a
Mhm.
ICU doctor? Yes, so that happens as well. But
Yeah.
pre-transplants or recipients or potential recipients are also generally very sick and in the ICU. So for example, a lot of times people have acute fulminant liver failure. So that
Mhm.
was what we took care of a lot of in the transplant ICU when I was doing my fellowship. So definitely saw pre-transplant patients immediately post-op. People don't realize usually after a transplant, particularly if it's a liver, lung, or heart transplant, you go to the ICU for at least a couple days, if not longer, um, so they can monitor you closely. And generally, those were the patients who were also, sick to begin with too. So we saw them pre-transplant as well. There are also people who are at home and they get a call. Obviously, we're not taking care of those patients right before because they go to the OR as soon as they get to the hospital. But I've seen a little bit of everything at this point.
So you really saw that transformative experience of patients who are in end stage organ
Definitely.
failure right before the transplant, and then seeing them the days afterwards as they're coming into the ICU and recovering. How big of an impact that transplant can have on those patients.
Absolutely. I would say, especially with a heart transplant, I mean, you would see immediate. I'm not just biased because I am a transplant recipient myself, but in general, I mean, you see that immediate once they get extubated. You can see how well they're breathing, how different they look. If they're liver transplant recipients, their jaundice goes away. So it's something that you see pretty immediately post-op.
That's incredible. That's and so then about 2 years into your residency at 30, you unexpectedly experienced some heart failure. Can you tell us about like what was that experience, especially for someone who's so knowledgeable and aware of the medical treatment and your condition? What was that experience like?
So, yeah, you're right. So about 2.5 years, two and a half years into my residency, I was 30. I had no medical problems. I probably had been to a doctor myself just a couple times in my life, in my 20s. And suddenly I began experiencing shortness of breath. And so I found myself in the emergency room, you know, being taken care of instead of taking care of other patients. The last thing I thought, because a lot of people ask me, they're like, "Didn't you know it was heart failure?" No, the last thing I thought was that it was heart failure. Um, I remember thinking at the worst it could have been something like pneumonia that I would get hospitalized for, get some antibiotics, and get discharged home. But I got very, very sick. I was admitted. They had to resuscitate me at least once, and then they took me to the cath lab. I don't remember most of this, but they found out that my cardiac index had been something like 1.2, which is absolutely not normal. And they, even then, when they told me that I had what they thought was probably subacute, it was probably something that had been brewing and then, suddenly showed up because I had this predisposition that I didn't know about. And I probably got sick or something happened that like triggered that gene to turn on. And I found myself in heart failure. So a lot. it was definitely strange being the patient. It was very surreal. I don't remember a lot of it, obviously,
Right.
because it was just about 6 years ago, in this week. But
Congratulations. Very
yeah,
exciting.
thank you. So it was definitely a different experience. And I think for someone like me, having I didn't have that much knowledge because remember, this was when I was a resident. So yes,
Right,
I knew
right.
about the transplant, and I probably knew more than just a patient who had not gone to medical school. But still, it was still all new to me, and I still don't. I mean, I feel like I thought I was like, well, what's the worst that could happen? I mean, just put me on some Lasix and I can go home. Like I didn't think it would get or it was as bad as it was, even to the day of getting my transplant. I remember thinking like, all right, just I'll just get a transplant and go home. Like I didn't realize how serious it was. So who knows?
Well, that's I mean, that's gotta be, uh, incredibly stressful, and then what was the recovery like after the transplant?
The recovery, so I was acutely ill, right? So I didn't have like years of heart failure. I mean, I remember I went to the gym even just about a week before I was hospitalized with all this stuff. So because everything was of mine was more acute rather than chronic, my recovery, and this is what I tell other patients too, is that if you're overall healthy right before a major surgery, it's still going to be difficult. It was absolutely difficult, but it was almost like I was going back to who I was just a month or so ago.
Right, right.
And so my recovery was the emotional aspect was definitely more difficult for me. Like I remember not even understanding if like I remember getting discharged just a few days after the heart transplant and not totally understanding like if I was a chronic you know, heart failure patient. Like I was like, "Well, no, I'm not," because I was fine a month ago. I got my transplant and I'm fine now. Like I feel like I didn't even understand what to label myself. It was really really tough for me to come to terms with the fact that my life was never going to be what it was in November of 2018. But I feel like over the course of 5, 6, 7 months, even the first year, it got a little bit easier every day. So physically, the recovery was difficult, obviously, because I had been hospitalized for almost a month, and I had to get muscle strength and all that back. However, I think the emotional part was a little more difficult for sure.
And I think like what you're touching on, heart failure and the conditions leading up to heart transplant can be a very different course. And so for many people, it can be a very chronic course where it's something they've been
Mhm,
grappling with for years, and the likelihood that they're going to need a heart transplant at some point is something that becomes more and more of a reality over months, if not years. And it's something that, to your point, while is physically they're physically decompensating, the emotional grappling with the benefits of a heart transplant they can go through with over a long period of time and feel much better right after they get a transplant. It's got to be a very different experience when you have an acute heart failure as you're describing, and it, th- you haven't had all that time. I mean, you were not fully conscious for a lot of that process
mhm,
leading up to the heart transplant to really grapple with that, and so you're really grappling with that after the fact. Is that fair?
mhm. That is exactly how I tell people it was like. Because a lot of people will say, like, oh my God, if it suddenly happened to me, that's even crazier than like, because, people who have had heart failure for 4 or 5 years, they've had time to think about it. Now, I don't think one is harder than the other. I think both have their difficulties. So I feel like it was very difficult to grapple with, and even the little things like remember in general most heart failure patients don't need a transplant. It's a very small percent that actually go on to need a transplant. And so not only was I had heart failure, I had this transplant, which is still pretty rare. But I also had to I was only 30. Like my life, I was like, well, I want to go back to work. I want to uh, date people. I want to do this. I want to hang out with my friends. So like even the goals that I had post transplant were different from what you would usually see in someone who's a little bit older. Maybe they're retired already and then they get a transplant. So I feel like all of it was just a lot. And I did exactly what you said. I feel like I really dealt with it afterwards. In the moment, I mean, people even said like, "Well, how did you say yes?" I'm like, "I didn't have a choice." Like they came up to me like, "You need a transplant," and I said, "Okay." Like, what do you want me to do? Like read a pamphlet for like 2 days? Well, I can't. I said okay, and then I figured I would think about it and figure it out as we go, which is exactly what I did. And so it was a very, very again, it was not easy. Luckily, the place that I got my transplant, which was Penn, they had a therapist. So usually, as psychosocial workup happens prior to transplant, they got to do like a whole thing on, are you mentally fit to get a transplant, and so that happens prior. But then they also follow you through the hospital. And luckily, I was at a transplant center that had these services post-operatively as well as an outpatient. So it was really nice having a psychiatrist, therapist, psychologist there if I ever had any questions. They helped me with some like coping behaviors and things like that. And so it was good to have the support I had. And I knew when and where and how to ask for it too. So that probably helped. But again, it was still very, very difficult.
So, I mean, I'm curious, in terms of the critical care work that you did beforehand and then having gone through it, is there anything being a physician and then experiencing it as a patient that you would give advice to physicians in terms of helping patients through this experience? Because it's massively transformative, but um, most physicians, like you said, they're straight A students, incredibly well informed, but they have not gone through this. As one of the few people who have gone through this, do you have anything you've taken away from it that is you would share with other physicians?
Yeah, a lot of people will say things like, "Oh, you're probably such a good doctor because of this," and I actually don't say that. Because there are plenty of good doctors who don't necessarily have to go through a cardiac arrest to be a good doctor. But I do think that having someone like me who's very open about it in general as a resource, hey, how does getting a central line feel? How does getting an arterial line feel? What is your advice to me as an intensivist, if somebody asks me things like this, to utilize me to maybe listen. If sometimes it's easier to listen to another doctor rather than someone who's just telling you what to do. So I feel like if they're able to use the resources that they have, or ask me questions if they have any, it should also help them in their practice. As far as what I've learned, and what I've taken away from my I mean, so much. I tell people that I went to medical school and also patient school, which is very, very like, it's very cheesy, but it's true. There's so many things that I learned as a patient that I never knew about as a doctor. And so even the little things like, um, we're so used to it. And I specifically am used to it because again, I work in acute care. So when I order labs, when I order things, I just order them stat. Everything's done like immediately in the ICU or in the ER. And like even the little things, like I tell residents nowadays, or I'll tell like my colleagues, when you put in things, maybe you could group them together so the patient doesn't have to get their blood drawn 100 times during the day. Or if you're ordering an echo, make sure it's done at reasonable time. Of course, unless it's an emergent echo or something. Like I remember I would get woken up at like 4 in the morning for like an echo, like again and again, and I'd be like, "Can I just sleep?" Like sleep is so important to patients, and like we do not sleep well in the hospital. So even the little things like that really, really help us. And then sometimes we think about, oh, it's just a stick. I had to get central lines in my for right heart caths, and also just because we needed it for pressors. And I remember one of the things that I never realized really mattered is anytime they would stick a needle in to get a central line in my neck, um like it's not so much the pain but the discomfort of like hearing the blood drip, because it's right by your ear, and it's like not something that, I mean, I've done hundreds of central lines, man. It's not something that I ever even thought about. Like,
Right, right,
oh,
right,
maybe
right.
if it's dripping it, or like the wire going in, it's right by your ear. You got to remember
You
these
can you can
things.
actually
So
hear it.
you can actually hear the wire go, and like even as somebody who knows what's going on, there's very little risk to this procedure. It's still nerve-wracking. So when I tell these experiences to my colleagues, they're like, oh, I never thought of it like that. So I think definitely learned a lot of those little things. And then just the importance of sleep. I mean, I still have sleep issues from my ICU hospitalization that was at this point 6 years ago. Like I have so many, issues with sleep just because I remember like the beeping and again, some of it is out of our control. When you have a really sick patient in the ICU, you can't just like not do anything for 8 hours while they sleep. But, if they're not necessarily super critically ill, we can maybe give them a break for 5 hours in the night and let them sleep. So yeah, it's been really, really transformative. And I think the way that I see it, and I'm not a religious or spiritual person by any means, but I think the only way that I really found myself being able to heal from everything was telling myself that, hey, you know what? If I've been through this, then I should look at it as kind of not necessarily like I want to use I'm going to use the word blessing, but I want maybe more of like a skill that no that not every doctor has, like this extra sense of knowing what's going on with the patient that is just mine. And not every doctor has this like perspective that I do. So I see kind of like a skill or blessing or whatever it may be. And that helped me justify what happened to me and actually helped me heal through, especially in the first couple of years. A lot of people get very upset when they go through things like this. Like, why me? I was doing everything right. Yeah, I was too. Like, I was 30. I had ate well. I exercised every day, and I was in medical. I finished medical school. I was a doctor, so I feel like it was one way to really justify, at least help me process everything that I went through.
Absolutely. I mean, your story resonates with me so much. Just my own personal story. Um, I had been in medical device for half a decade, and when I had a young family, my second daughter, who's fine, was diagnosed with cancer when we were in the ER. And same thing as you, right up
Right.
until that moment, it kind of hit me out of the blue. Um, and then we went through this experience of her going through her cancer treatment, which was extraordinarily intense. She got every treatment under the sun, but for me, one of the things that experience in the ICU, in the patient rooms, on the floor, surrounded by medical device, has really informed how I look at medical device development. Of these lights or flashes or sounds that these machines make can be very impactful to the patient experience, and it's something that I think experiencing some of the little nuance on from the patient side does really change the way medical professionals who are developing care or providing care can bring towards treating their patients. And it is a unique experience to go through something like that and come out of the other side and still be in this field.
Absolutely. Absolutely. There's little things that you wouldn't have known had it not been for your daughter going through that, right? That's
Absolutely,
kind of how I see it.
100%. And so and on the flip side, now, once you came out and you sort of came to terms with having a transplant, I think you also have a unique awareness. Not every patient has access to the full gamut of medical literature and medical background to really understand every aspect of their condition the way a transplant physician would or a critical care physician would. Um, how has that been a different patient experience, knowing sort of some of the complications and risks and all of the medical literature from a more scientific clinical standpoint, as opposed to just a normal patient experience, if you will?
I think a lot of people assume that because I'm a doctor with the background that I have, I definitely want to know everything, and I'm well. First of all, again, caveat is that I'm not a transplant doctor, so there's plenty of things that transplant cardiologists or nephrologists know that I don't. Now I do know the nuances. I understand, especially I understand what's the worst that could happen because that's what I deal with. So it can be nerve wracking at times, but I feel like I sometimes live in this like ignorance is bliss. Like people assume that if I get an echo or if I'm, at the doctor's office, I want to know everything. In it, like actually, when I'm getting an echo, I don't even look at the machine, which is like I'm always like, oh, like let me just, I don't want to see it
I'm
because I
just
know
going to
if
be
I
a
look at
patient
it, I
today.
get. Yeah, and a lot, and even doctors they'll be like, "Oh, like should we go down on your program?" I don't know, do whatever you want to do. And so it has been good in some ways because I am able to do, I have access to up to date. I can research things. I can ask if we can try something new for me. But at the same time, I try not to take too much advantage of that. And when I have to be the patient, I try to just be the patient. I think and sometimes it's a little too, like, I think I could probably stay in a doctor's office for 2 hours and not come out and say like, "Hey, can someone see me?" Because I just, like, I know what they're going through. It's okay. I'll wait 5 hours if I need to. Sometimes it's to the detriment, but yeah, in general, I feel like I have been able to definitely use the background that I have in good ways, but I'm also someone who kind of takes a step back when I'm in that position.
Yeah.
And I do think it's also interesting when patients, like, a lot of my friends now are transplant recipients, so they will, they'll send me their labs and they'll be like, "Oh, what is this, like, elevated, like, MCW?" I'm like, "I don't even know what that is." Like, don't worry about that. It's not there's a lot of things that some patients do focus on. So I do feel like I at least try to focus on, I don't want to say the correct things. I just focus on more of, like, the bigger picture things
Yeah.
in general. Like,
Yeah.
am I gonna die from this? Like, those are the things that I will end up, like, caring more about. And so, yeah, and I've heard it from multiple doctors and nurses, and like, "Oh, you're not like a typical doctor patient," which I think is a good thing, but I don't know.
Well, that's certainly fascinating, and so also curious. You're now working at an organ procurement organization who works on the donor side of transplant. You yourself, I believe, you did reach out and were able to meet your donor or your donor's
I
family.
was. So the way it happened was, and every region, every country, every region, every OPO is different. But in general, you have to get consent from both the recipient side and the donor side. You go through the OPO for quite some time. There's a lot of disclosures that need to happen. Everything has to be anonymous in the beginning. So I had reached out. I had written like a thank you, like a very like, I didn't put too much thought and effort into it, only because I knew that I definitely wanted to reach out to them at some point. But this was like just a couple weeks post op, so I remember I sent them like a very short letter card, um and didn't really think much of it. Most of the time, most donor families don't really reach out to the recipients. And then a few months later, I got a letter, and again, keep in mind everything's anonymous, so they have to, like, black out the names and, like, specific things like location. But I found out that my donor had been a younger woman, I- and not too much detail, but like, she loved animals. She was engaged, like, things like that. And then eventually, over the course of the next, I think for about 1 year, we didn't really keep in touch. And then about a year later, I my OPO reached out to me again, and this was when I was moving to New York City for my fellowship. So they said, they want to communicate with you more, and I was okay with it. We ended up opening communication, which means that we don't have to go through that third party anymore. And so we were writing letters to each other, eventually got our emails and social media. And so my organ donor had been, Lucy. So, and her mom Laura and her whole family has reached out to me multiple times. We've met quite a few times. And when we first reached out, like, it was really interesting seeing that her family had been doing just as much for organ donation awareness that I had been doing on my end. Lucy had had a sudden, she had had a brain cyst rupture. So, and one of the most interesting things was that when she was brain dead, her mom actually reached out and said, "Can we do organ donation?" She had wanted to be an organ donor, but it's very rare for the family to bring it up in general, and in these crazy tragedies that happen to people. So her mom had reached out. Lucy ended up saving the lives of 4 people. It had been me, 2 kidney recipients, and a liver recipient.
Wow.
And the mom really tried to keep in touch, and it's just been amazing. I still keep in touch. I saw them. Not only did I go there to meet them in upstate New York, but they also came to LA and hung out with my family last year. We talk all the
Incredible.
time. Yeah, it's great. Lucy had been in respiratory therapy school, so it's almost like
Really?
it's yeah, super coincidence that I happen to be, like, I work in an ICU, so it's incredible, and she almost finds like it's so nice to have like her daughter's heart doing something that she wanted to do too. But I think and she always, her Lucy had always wanted to save lives, and I said, she saved the lives of others by this gift of organ donation. So it's been incredible. I love that family. They're my second family. And yeah, it's been nice getting to know them.
That's absolutely incredible. And now you
Yeah.
are devoting a lot of your time towards organ donation as part of Donor Network West. This is one of the
Hmm.
organ procurement organizations. Um, i- that's got to be a very challenging job. Can you tell us a little bit? First, can you just explain a little bit about what the role of an OPO is in the
Sure.
organ transplantation process.
So the OPO is kind of the in between a donor hospital and transplant center. Uh, Donor hospitals are, there are hundreds of thousands of hospitals across the nation, and not that many transplant centers, because people always assume that organ donors come from transplant centers, but that's not the case. And so a lot of these are small community hospitals, and an OPO kind of does the coordinating between the two. So if there is an organ donor or potential organ donor who dies at a particular hospital, then the OPO will find out about this potential donor or donor. They go there. We have our own coordinators, nurses. We have our own directors, who some are on site, some are I'm off site, but some are on site, who go there, help with the management, and then eventually we have people who allocate the potential organs to the transplant centers, and it kind of goes from there. So basically, the OPO is the entity that helps figure out what to do with potential organs and where they go. And it's been really nice working for it's been really nice working for the OPO, because I knew a lot about the transplant side, obviously, but I didn't know that much about the organ donation side. I've had taken care of organ donors until working here, but not that often. And so, as medical director, there's a couple of us, and we basically help with, you know, writing the policies and guidelines on managing these organ donors. We help with things like infectious disease testing, or, if there's a question about a potential donor, they're on this pressor. What should we add next? What medication should we give for their urine output? And we basically kind of help manage these donors up until the point of procurement, which is done by the transplant centers.
Which, ha- given your background and everything you've been through, is that rewarding to be part of the process in order to make sure that organs can go to more transplant recipients?
Oh, it's definitely rewarding. Our team knows, especially when I'm on, like, I am all for getting as much as we can, doing as much as we can. Even if there's, what we call marginal donors, or we're not really sure, I still try really hard to see what we can do with potential organ donors. So it's been very rewarding, and it's been really nice. Just, I'm still pretty, I would say, like an early career attending. I only finished fellowship less than 2 years ago, so I feel like I've learned so much on the job, not just about organ donation, but management, direct, like, being a director, helping with certain things, policy writing, things that are going on more of like a political level, things like that. So I feel like not only is it rewarding because it's organ donation, but it's also rewarding because I've grown so much in this position.
I I think that it's really interesting because the field is changing a lot. Like you're saying, there's a lot of
Hmm.
policy changing. There's a lot of challenges, but there's also this growth in organ donation, which is fantastic. And I would imagine from your experience with Lucy's family, you've also seen just how meaningful it is to families to get organs placed. We've had that experience. Our team members have been on cases where the donor family is incredibly grateful because we've been able to help get an organ placed into a potential recipient. So, I mean, that's
Hmm.
got to be something that you've really seen this whole field from
Through and
every
through.
possible angle, if you will.
I have. I'll just use that tagline now.
Absolutely, absolutely. Feel free. So now your 6 years. Congratulations on from
Thank
your
you.
heart onto your 6 year anniversary of your heart transplant. Um, you seem, we've met in person a variety of times. You seem like a perfectly healthy person, like a perfectly healthy physician, right? Are you? Uh, is that sometimes hard for people to grapple with? That, oh, you have a heart condition, or you have a heart transplant. That is there a disconnect there ever when you're meeting people or explaining that for the first time?
Oh, there definitely is because I feel like, and I actually just recently wrote a piece about this. It's going to come out soon. But I'm in this weird limbo, right? Like because I mean, and I look healthy, and people are usually like, "Oh, you don't look like you have a heart transplant." Well, what am I supposed to look like? Like, what is, So I feel like sometimes, and when people say things like that, I'm only like, I understand nobody means it in a malicious way, but if I supposedly look this good and I'm working out and doing all these things, I'm telling you that it's only because I work really hard to get to where I am. So I do think that people don't understand that, yes, I'm fine, but the anxiety of like I could get sick at any second. I can get sick at any second. I got to be careful. I mean, even my boyfriend, he wants to go on a cruise, and like the last couple days I've been literally like doing like risk versus benefit analysis, like trying to make it into numbers. Like, what is the percent of like me getting norovirus? What should I like? So my life is not like, it's not easy. I try very hard to perhaps make it look like I'm doing okay, and I think overall, knock on wood, I am doing okay. But it still means that I go through a lot every day. I live in a transplant limbo is what I called it in the paper, but it's it's it, I think it's a part of life is understanding that it's not always going to be perfect, and we all have our own struggles that we have to deal with every day, and sometimes things aren't going to be good. And I think actually knowing that, like, I've already, for lack of better words, I've already died once. And so there's when people get a transplant, they either live like there is no tomorrow, or they're like super cautious about everything. Like it's those two things that I see generally. And that's kind of, I'm kind of in between the two. Like I remember when COVID was happening, like I was living in New York City at that time, my dream city to live in, and I wanted to go out. And the way that I like did my risk versus benefit analysis, I was like, well, I'll just say yes to like every other time we go to dinner. Like, so like maybe that'll reduce my chances of getting sick. So I feel like I have to deal with kind of that limbo. And by the way, this when I say these things, I also tell other recipients, like, some people are just more risk averse, and that's okay. Some people would rather not do as much, and that's okay. And some people want to do whatever they can, and that's okay too. It just kind of depends on your personality. It is just a weird limbo that I live in. One of the best questions I got, like right after transplant, maybe a few months after, I went out with some friends, and they're like, "So are you okay now?" And I was like, I think like, I don't know what okay is. I think I'm okay. Yes, I don't know.
So, what would be, if you were to give a recommendation to a friend of a transplant recipient? What would be the best support or question you could ask?
I think honestly, there is no one thing, because obviously my family and my friends were there for me um through so much, and it was never one specific thing that I needed or wanted. Just knowing that they're there was the most helpful. Um there was never one, and I'll tell you, and I've told you this personally in the past too, but one thing that I tell people that we don't really notice that much, especially when we're in the ICU, is like the caregivers and the family of that patient are probably going through a lot more than what that patient's going through at times. Like and there aren't that many resources for caregivers, if I'm not mistaken. Some we do have some more nowadays, but in general, like I remember my parents were like, "So what do you want me to do?" Like, which is, and at one point, my parents, who again, I was 30 at the time, and like every day they'd come to the hospital with like food, and I wasn't hungry. I was in like fulminant heart failure, and like at one point they came with like an iPad. I was like, "Oh, okay, I think I'm gonna need an Apple Watch next." Like, and then I told them, I was like, "There's not one thing that you can do or say, but just knowing that you're taking the time out of your day to be there for me was the most helpful, in my opinion." Um,
I
so
mean,
yeah,
I can
that's kind of what I would.
I can say from my own experience, as we touched on earlier, I remember asking. the psychologist on our unit, you know, my daughter was going through so much, so many, like waking up around the clock, like you're describing, things like that. And, do these kids ever get PTSD from that experience? And they said, no, it's like a 0.001% chance that
Yep.
get PTSD. But the parents, 75% of the caregivers get some signs of PTSD, and a quarter get full blown PTSD. So it's not surprising to me what you're saying. It is it is tough on the caregiver. It's got to be tough on the caregivers to see your loved one going through this and trying to find the way to support them.
Yeah, absolutely. Especially as a parent, I can only imagine. Uh, as far as I don't know the exact numbers on PTSD, but I definitely could tell you that my parents, like my dad will sometimes be like, "Oh, I'll never forget like how much pain you were in after that," and I was like, "I don't remember much pain. Like I was on a fentanyl drip. I don't remember." But so I feel like definitely, and they definitely went through a lot. My friends too. I mean, one of the friends who had been on call the night that I got very, very sick and had to be resuscitated. I mean, she told me herself, she's like, I can't go to resuscitation because I'm like, she's like, it was just so traumatizing in the first few months after that happened to me. And I was like, oh, sorry, I didn't, I don't know what to say to that. But yeah, definitely, I agree with that.
So as you look forward to the future with your role in transplantation, your career now, what are you excited for transplantation, and where do you see your career going in medicine, whether within transplantation or beyond transplantation?
Oh, I mean, there's so much happening in transplant right now. I mean, obviously with you guys at Paragonix, all these things with NRP, we're trying to, increase the donor pool. We're trying to use organs that weren't necessarily used before. So I think the field itself is growing and it's only going to grow and get better from here. Um, so, I would say that that's one thing to look forward to in the future. I think another thing, like I said, these advocacy resources, um, people who got transplants, like I have friends who got a heart transplant maybe 20, 30 years ago, and they say things like, oh, 20 years ago, like the doctor would just tell us what to do, and like there was no services to like, or, there were no emotional like service, there's nothing to help with us actually going through it, nothing for the caregiver. So I feel like more patient centered um uh care, and things kind of going towards like a holistic view of taking care of these transplant recipients and donor families. Honestly, I don't think it's just one population that we're looking at. That's also going to improve in the future. I think just now, as a doctor, as somebody who is again early career attending, went to medical school within the last 15 years, like we're taught to make every decision with the patient. You can never tell a patient what to do. You can only recommend and like have a discussion. And so even those things are changing. I assume things weren't like that before because sometimes I'll say, if there's a nurse at bedside with, I'll say, hey, what do you guys want to do? And like, just tell us what to do. I'm like, no, no, we got to discuss. Like, these are the options. What do you guys want to do? So it's a very multidisciplinary, holistic approach that we're taking nowadays that is much more patient centered in general. And I think that will just improve towards the future.
It's got to be exciting when you meet and make friends with 25 and 30 year transplant recipients. That's got to be also quite inspiring, if you will.
Absolutely. When I first got my transplant, obviously like, I didn't look this up until after, but I remember I was home and you have your manic from all the steroids that you're on. So I would like stay up all night and like go on Reddit about like stupid things. And I didn't realize like prognosis for like I just thought I could live a normal life. And I remember one of the first things I saw was like, oh yeah, like median life expectancy post heart transplant is about 5 years. But that study was done, if I'm not mistaken, like late 90s, before there were these new calcineurin inhibitors and different medications that we take. So I remember being like, oh, I didn't I didn't know that. And then I started meeting people who are like 20, 30 years out. I think there's even someone who was 40 years out recently. So, things are improving for sure. And it's so nice to meet these people. In general, it's just nice meeting young transplant recipients because I feel like we go through very similar things and it's been nice.
There's a lot to relate on there.
Exactly, exactly.
And you also have are the co-host of a podcast on both sides of the stethoscope. Can tell me a little bit about kicking that off and what
Yes.
that journey has been like.
So, when I first got my transplant, I mean, obviously, it was really nice connecting with others who were around my age with transplants. So I made like a WhatsApp group called the Zipper Club. That's what we call our scar. With a,
Oh my
and it was
gosh.
mostly like it was yeah yeah it was women with heart transplants, and it was nice to talk to them. But even more so than that, it would I was like, I wonder if there's other doctors with transplants. And I met one. She had been a pathology resident with a lung transplant, and and then I met like another a nephrologist with a kidney transplant. And then I met another. It was Kobe, my co-host. He had a heart transplant as well. At that time, he was an internal medicine resident. So I was in emergency medicine. He was internal. And at that time, he was like 5 years out, and he was like, "Oh, I just do everything I want. Like I'm fine." It's been great. And he was like such a beacon of hope for me. He's one of my best friends. We got very very close. And um I did two things. One thing was I really wanted to just make a group of some sort where we could all connect. And at that time, it was just like those us four with a group chat. And now I think it has like over 70 members of physicians who also have organ transplants. So it's been really nice to connect. On top of that, Kobe, my co-host, he had always thrown this idea around of making a podcast about what it's like being on both sides. And so we started it a few years ago in 2021, if I'm not mistaken, kind of on a mini hiatus right now. But as you guys know, you guys helped sponsor us last year. It's been amazing. We try to get different people on the show, not just recipients, but also physicians or scientists. We had Lisa on the show, so um, it's we kind of go through not just transplant, but in general, what it's like seeing the both the patient side and the medical side, the doctor side of things. I'm excited for it to grow too. Kobe has been amazing. He's basically the person that I go to for everything. Like, hey, has this ever happened to you? Yeah, it has. Like, you'll be fine. Has this ever happened? What do you get a CTA? Do you get a CTA or a cath? Like, what should I do here? So and now, as I forgot to mention. So after he did internal medicine, he did cardiology, and now he's finishing up his advanced heart failure fellowship. So pretty sure he's going to be the first heart transplant recipient who is also a heart transplant doctor, but I might be wrong on that.
Well, we're gonna hope him the best in his heart failure fellowship. So, well, thank you so much for all your time. Are there any sort of initiatives or events or anything that you'd like to highlight that's coming up?
In general, I tell people general is to get involved. If you're a patient or if you're a patient advocate who wants to get involved with professional societies, you definitely can through AST, through ISHLT. Any of the major societies usually have or are trying to have kind of patient centered committees as well. So, you know, it's something that a lot of people ask me, like, how do you get more involved? Well, try to go to the professional society and see if they have any extra committees or any initiatives that they need help on as far as patient centered care. So that's probably my main thing.
Excellent.
Oh, and I should also mention our podcast, but I think you mentioned in the beginning it was both sides of the stethoscope, which you could find on Apple or Spotify or any of your podcast platforms.
Absolutely. Definitely check it out. It is an excellent podcast. I recommend anybody to listen to it, whether or not you're a transplant recipient or physician.
Thanks.
Well, Lean, it's always so good to see you. Thank you so much for making your time today and joining us. I really appreciated the conversation. Thank you so much.
Thank you. Thanks for having me.
Absolutely. We'll see you next time.